This tutorial covers how to submit 2024 data in our online data portal to receive a 2025 Achievement Award for the American Heart Association's Outpace CVD program, Target Type 2 Diabetes. Log into the data platform at aaj.infosarioregistry.com/login using the username and password sent to you via email after registering. This slide contains further details on how to register your organization and get a user account. You will submit Target Type 2 Diabetes data through Program Forms. Click either the icon under Get Started or the link in the left navigation panel. If your organization has submitted in the past, you may have existing forms under the Edit Form section, like I do here. Each date represents the calendar year from which that data was collected. For a 2025 award, you'll need to submit a 2024 form. If you or another member of your organization have started a 2024 program form for Target Type 2 Diabetes already, you'll see that here. If so, click to start adding data. You can see that I have a 2024 form for another program, Check to Control Cholesterol, already. I don't have a 2024 form yet for Target Type 2 Diabetes, so I'm going to click Add New next to that program. I'm submitting for a 2025 Achievement Award, which is based on 2024 data. So I'll type 2024 in the reporting year field and hit Submit to start the form. Target Type 2 Diabetes has 3 tabs of data to enter, found under Tabs on the right. The first tab, Participant Information, contains questions about your healthcare organization, including your total adult patient population in question 3, a breakdown of your patients by race and ethnicity, as well as a breakdown by payer group. The gray boxes on questions 5 and 6 cannot be edited. They auto-populate to total the number of patients entered above. That's because the patient breakdown by race and ethnicity, as well as the patient breakdown by payer, must equal your total patient population given in question 3. The second tab includes questions on your clinical practices. Questions 7 through 12 are meant to serve as an assessment of your organization's practices for diabetes care, particularly assessing and managing risk for cardiovascular disease, including awareness of the Prevent calculator, use of guideline-based medical therapies, and preventing chronic kidney disease. If you are unable to answer a particular question, please check with clinical staff familiar with these areas. You must answer yes on question 13 to be eligible for an award. We've also added a new question on the quality improvement activities your organization engaged with in 2024. Tab 3, Measure Submission, includes the measure denominator and numerator questions that will determine your measure performance and subsequent award status. There are 3 opportunities to enter measure data. The program's main measure, diabetes hemoglobin A1C poor control, is required for award eligibility. Note that this is an inverse measure, which means it's measuring a negative patient outcome. A lower percentage indicates better outcomes. The other 2 measures are cardiovascular disease-focused measures. You only need to submit data for one, either MIPS 438, statin therapy for the prevention and treatment of cardiovascular disease, or MIPS 236, controlling high blood pressure. These are standard measures where a higher percentage is indicative of better outcomes. For award eligibility, in addition to answering all questions on the Participant Information tab and Clinical Practices tabs, you must enter data for the diabetes measure and one or both of the cardiovascular disease measures. Choose whichever is easiest or demonstrates the best performance. Note that these measures are identical to those included on our other outpatient program forms for target BP and check change control cholesterol, so you may already have this data easily available. Do not narrow these measures to only patients with diabetes. However, while these measures are included on the other forms, the data is not shared between the forms and must be re-entered into this target type 2 diabetes form. Once all fields are complete and no errors are detected, return to the Participant Information tab, where the Data Entry Complete checkbox becomes available. Check this box to mark that you are finished entering data and then save. You can save or save and exit and come back at any time to revise your data. A snapshot of all data in the platform, complete or incomplete, is taken at the date and time of the recognition deadline to determine award status, but you can revise your data at any point up until the snapshot time. Let's start entering our data. Before you begin, make sure the data you submit is representative of the healthcare organization you're currently viewing. Look left under Currently Viewing or at the top right to orient yourself. I recommend having the data collection worksheet available or filling it out beforehand for ease. You can find this worksheet by navigating to the library on the left. I'm right-clicking to open in a new tab. In the library, click on the Target Type 2 Diabetes Data Collection Worksheet to download the PDF, and then open it. Questions may change from year to year, so please ensure that you have the latest data collection worksheet, which you can find on the top of the first page. The worksheet contains additional guidance on how to answer each question, especially for question 6, which asks for that patient breakdown by their primary payer. Scroll down to the final page to see detailed guidance. You can also use the official measure specifications for each measure, which you can find by navigating back to the program form and opening the Measure Submission tab, then clicking the link for MIPS 1, MIPS 438, or MIPS 236. Here are what those measure specifications look like. I've navigated back to the Participant Information tab to get started. The first question asks if your organization diagnoses and manages patients with diabetes up to and including prescribing medications. A yes response is required to be eligible for a 2025 award. The second question requires you to certify that the attestations entered in the form are accurate to the best of your knowledge. A yes response is also required here to be eligible for a 2025 award. Question 3 asks for the total adult patient population ages 18 and above who had an office visit in 2024 for your organization. When pulling data for this question, make sure you are saving this query and can further break down that same patient population by race and ethnicity and by payer group. My demo organization had 42,897 patients ages 18 and above. For question 4, input how many providers your healthcare organization has. We are looking for all clinicians, physicians, nurse practitioners, and physician assistants in your outpatient organization. My demo organization has 92 providers. In question 5, we ask for a breakdown of how your total adult patient population, ages 18 years and older, self-identify by race and ethnicity. This question is based on Table 3B of the HRSA Uniform Data System reporting requirements for 2024 health center data. The same question appears on our Target BP and Check Change Control Cholesterol program forms, so you may already have this information available. All fields must contain a value. Please enter a 0 where there are no patients. Here is the data that I have. The final three fields are inclusive of all patients who have either their race, ethnicity, or both unknown or undisclosed. If they have identified as Hispanic, Latino, or of Spanish origin, but not disclosed their race, place them in the first of these three final fields. If they have identified their race, but not their ethnicity, place them here. Finally, if you know neither their race nor ethnicity, place them in the final field. Once all fields are filled in, an automatic total of what you have entered populates at the gray box at the bottom. This box must equal your answer to question 3. For question 6, take your total adult patient population given in question 3 and break it down by the patient's primary payer. Not sure which group is considered your patient's primary payer? Use the guidance on the last page of the data collection worksheet for questions. Here's the data that I have for providers and payers. If you're still not sure on some patients' payer groups, put them under the other unknown category. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. If it does not, say I change my other unknown to a 0, an error will appear at question 3. Because this is a red error, I won't be able to save. For red errors like this one, I can delete one of the fields that's contributing to my subtotal to make the error disappear. This allows me to save and come back later once I have identified the error in my data. However, all fields must be filled in to be eligible for an award. So in order to fully fix this, I must eventually either revise question 3 or my payer group totals so that they match. Next up is the Clinical Practices tab, which can be found by clicking the Next button at the bottom of the screen or the tabs icon on the right. This section highlights our focus of including equity in care, accelerating team-based care models, and empowering individuals to be active participants in their care. Knowing and implementing the latest clinical guidelines is critical to supporting each of these goals. To better support our organizations in their awareness of and use of the guidelines, we want to continue to learn about your current practices. Note, as you enter your answers to these questions, please consider the organizational area that your data submission represents. For example, if the facility name in the data platform is ABC Health System North Clinic, and the other data submitted are specific to this facility, please answer the below questions with only North Clinic in mind. However, if you are submitting data on behalf of the entirety of ABC Health System, please answer the below questions with the whole of ABC Health System in mind, to the best of your ability. Question 7 asks, which of the following key characteristics do your clinical teams address for patients with type 2 diabetes as part of standard protocols? Select all that apply. My demo organization addresses current lifestyle, comorbidities, clinical characteristics associated with CVD risk, and social determinants of health, but not issues such as motivation or depression, so I'll leave that blank. Note, the last two options, 1, that you do not have a standard protocol, or 2, that you are not sure of the key characteristics, cannot be combined with any of the previous options. Question 8 asks, when your organization operationalizes treatment plans for managing patients with type 2 diabetes, which of the following considerations does the treatment plan include as standard process? Make sure to select all that apply. My demo organization's treatment plans include the use of guideline-based treatment algorithms, the use of the pooled cohort equation CV risk calculator, and the use of guideline-based pharmacologic therapy inclusive of SGLT2 inhibitors and GLP-1 receptor agonists. Again, you cannot select any of the last three options in combination with other selections. Question 9 is a new question in 2025. The American Heart Association launched a new tool in November of 2023 to predict a person's long-term risk of cardiovascular disease. The Predicting Risk of Cardiovascular Disease Events, or PREVENT calculator, aims to help clinicians implement risk assessment for cardiovascular disease and facilitate clinician-patient discussion to optimize prevention for cardiovascular disease, including ASCVD and heart failure. This tool factors in kidney disease and metabolic disease, including type 2 diabetes and obesity, as well as indicators of social deprivation. We ask you to describe your organization's familiarity and use of the PREVENT calculator. At my organization, some clinicians use the PREVENT tool as a standalone tool, but it is not integrated into the EHR. Question 10 is broken down into 6 sections. For questions 10A through 10F, please indicate where the specific therapies are being prescribed for patients with type 2 diabetes. Each question asks about a different therapy or group of therapies, including angiotensin system blockers like ACE inhibitors, ARB or ARNIs, other antihypertensive medications such as beta blockers or diuretics, lipid-lowering medications, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT2 inhibitors. Each sub-question gives you the option of family medicine or internal medicine, another specialty, for example, general cardiology, specialty clinics such as those focused solely on lipid or cardiometabolic care, or none of the above, because either you refer to external specialty providers or because you neither prescribe nor have a process for referral. I'll complete my answers now. Question 11 asks about the barriers your organization experiences in relation to the initiation of guideline-directed medical therapies for cardioprotective antihyperglycemic agents such as SGLT2 inhibitors and GLP-1 receptor agonists for patients with type 2 diabetes. If you select the first option, system-based barriers such as formulary or prior authorization limitations, an additional question will appear, asking for the factors that impact accessibility of those medications. If this appears, you must answer the question. Make sure that you scroll so that you can select all options that apply. Question 12 asks if your organization routinely evaluates kidney health for patients with type 2 diabetes. If you respond with yes, additional questions appear to gather more details on your organization's assessments. As in previous questions, you cannot select either of the last 2 options in combination with other selections. You also cannot select conflicting answers, such as stating that you both assess eGFR at least once a year as well as once every 2 years. Please note that you must answer these follow-up checkboxes if they appear. Leaving these unanswered would create a critical error which would prevent you from saving your form. Note, you won't be penalized for your answers in questions 7 through 12. These questions are largely a self-assessment to help identify where you may have gaps in standard best practices. These gaps may need to be addressed to improve patient outcomes. Question 13 asks if your organization is committed to continuously improving strategies for addressing cardiovascular disease risk in patients with type 2 diabetes. You must answer yes to be eligible for an award. Selecting no generates a note that tells me I'm ineligible. Make sure to save as you go. We've also added a new question this year about your quality improvement activities. Your response, while required, will not affect your award level. We want to know which quality improvement activities for diabetes management your healthcare organization engaged in during 2024. Please select all options that apply. The final questions are housed in the Measure Submission tab, which you can find by clicking Next at the bottom of the screen or under Tabs on the top right. Question 15 is the denominator of the MIPS number 1 measure, which is required for an achievement award. This denominator asks for patients who had a 2024 office visit and have been diagnosed with diabetes. Using the MIPS number 1 measure, which again can be accessed via this link, how many patients met these criteria? My demo organization had 6,434 patients with diabetes who had a 2024 office visit. Question 16 is the numerator of the measure. Of the patients with diabetes from question 15, what is the number of patients whose most recent hemoglobin A1C level taken in 2024 was above 9%? Make sure to review the official measure logic for all criteria. Patients with diabetes who did not receive a hemoglobin A1C test in 2024 still get counted in the numerator, along with patients whose test level was above 9%. Again, the lower the numerator, the better the clinical performance. My demo organization had 1,566 patients meeting the numerator criteria. In other words, 1,566 patients who were poorly controlled. Questions 17 and 18, as well as questions 19 and 20, are optional, but you need to answer one of these question pairs for recognition. Questions 17 and 18 are the denominator and numerator of the MIPS 438 measure. This measure asks for patients who are considered at high risk for a cardiovascular event under the American College of Cardiology and American Heart Association guidelines and were prescribed or taking statins in 2024. Use the MIPS 438 logic linked here. When calculating, you can determine how many patients are in each risk group and provide the sum of all four. But be careful not to double count patients who fall into more than one risk group. For full details on this measure, check out our video on how to submit data for check change control cholesterol. I'm choosing to submit data for this measure since I already have data easily available from my check change control cholesterol program form. My demo facility had 9,041 patients meeting risk group criteria. Of those at-risk patients, 6,930 were prescribed or using statins. Questions 19 and 20 are the denominator and numerator of the MIPS 236 measure. This measure asks for patients 18 through 85 years of age who had a 2024 visit and a diagnosis of essential hypertension starting before and continuing into or starting during the first 6 months of the measurement period. For full details on this measure, check out our video on how to submit data for Target BP. Remember, I can leave this blank only because I submitted data for the first of these two CVD measures. To complete your data submission, make sure you filled in both fields for the diabetes measure and fields for one of the cardiovascular disease measures or both. Once all fields have been completed, return to the Participant Information tab. The last step in our submission process is to check the Data Entry Complete box. An important note: if this checkbox cannot be populated, it means your data is incomplete and you may not be eligible for recognition. Please review both tabs and ensure no fields are left unanswered before exiting. I am unable to check the box. Scrolling through my questions, I can see that it is because I left the other unknown patient count for question 6 blank. Now that it's corrected, I will be able to check the Data Entry Complete box, which ensures that I'm ready for recognition. Finally, I'll click Save and Exit. Back under Program Forms, I now have a saved 2024 form for Target Type 2 diabetes. You can go back and edit your data at any time before the data submission deadline. As long as your data is complete by that time, you are considered eligible for an achievement award. Look out for regular newsletters and additional communications from us to learn more about recognition. Thank you for choosing to submit data for Target Type 2 diabetes. If you have additional questions, please contact us at bit.ly/aqcontactus, or if you need help logging in, you can contact our platform vendor using the email address on screen now.